First, there needs to be a recognition that the DTX solutions or digital therapeutics have actually the same health impact as you would find with a normal therapies intervention. So there's that clinical recognition, that's one side of it. The other side is the ease of implementation into their workflow. It has to be super easy and it has to fit into their systems. They're already overworked with IT and bureaucracy. So that's another actually very practical barrier to it is that. And then a really strong endorsement or mandate from the actual health system which they're a part of. I would say those are three key things. Yeah, on the recognition of the clinical impact, there I think there's a lot of work being done to make sure that the health technology assessments or regulatory assessments are being harmonized, or that there are clear guidelines for that. For example, here in the UK, there are some, by now, very good guidelines on how to do health technology assessments for digital therapeutic interventions. That's very helpful to drive that part of it. And the same goes for implementation, like to have national reimbursement like you have in Germany, like you're getting in France as well. And although the UK doesn't have that in the same way yet, there's a lot of work being done at the NHS level to make sure that digital solutions become scalable and actually plug into the system as well. So it's kind of working on both the two other barriers or key areas. So I think that's very country specific, whether the answer to that question. My impression is that the UK is doing reasonably well, at least comparable to a lot of countries. I think it can also be disease area specific, where the way that we're working at Brain Plus is actually to try to get in to the educators that are educating the therapists that are specific to dementia therapies, behavioral dementia therapies, which is what we're working with. So it ends up often being the DTX or the manufacturer's job to do the education of the clinicians. So yes, there could be more work done from a top-down governmental level on that, but it's not like the governments or the health system aren't doing anything. They are.